forget about say to your name or ask name or age or profession of the patient or actor, they will give you 0. Or if you will ask half, they will give you examiners, they will give you half points, okay, half mark. Understand? Okay. Purpose of the survey and consent. Explained. You have to explain the purpose of the interview and obtain the consent of the patient to take an anamnesis. Okay. Keeping your distance. Keeping your distance, not very near, not very far away. Okay. Observed, accepted the optimal distance for the patient. My students knows about which part you have to stay, yes, in right side, okay? He took care of the comfort of the patient. The doctor can, without getting up, freely reach out to the patient with his hand. Okay, collection of the complaints. And now you can start. I want to know what kind of complaints do you have? And actor will say all complaints, okay? Don't worry, they will not long story like real patients they will not say a long story of his life or her life, okay? Have all questions being asked to detail complaints. For example, we'll say I'm thirsty, I'm going thirsty. You have to, when they will say I have thirsty always, I have pain, food pain or a headache, something like this, you have to say when it started, what time it started, how it started, yes, etc. For example, other details also they will say collection of the anamnesis. Have all questions. Who's joining? Amazing. Okay. Details and collection of anamnesis morbi vitae. Vita, what do you have to ask, guys? You know, yes, these questions, yes, like case study. Remember, clarified whether there was stress, trauma, surgery, allergy, anamnesis, autoimmune disease, physical activity, etc. Clarify the family history of the pathology of the endocrine system, brother, sister, parents, etc. And the lead syndrome. The student clearly identified the leading syndrome and characterized the main symptoms and combines. You collected all questions, complaints, and anamnesis vitae morbi, and in the endings, you have to summarize and say, because these symptoms or anamnesis, I am thinking this is this syndrome, okay? Formulate of a preliminary diagnosis. Also, summarization technique, the briefly repeated what the patient said, namely problems, details of anamnesis, ideas, fears. For example, the patient said, yes, my brother or parents has autoimmune, some diseases of the pancreas. Yes, maybe some diabetes mellitus, for example. You can think about what diabetes mellitus or at least metabolic syndrome, okay? So a survey plan, having collected complaints and anamnesis of the disease, she made an examination, it means examination plan for these patients. So having collected complaints and anamnesis disease, okay, professionalism. Use active listening technique. Guys, you shouldn't cut the conversation with you ask it, for example, what the complaints, you shouldn't cut in the endings, you can ask, okay? Not don't cut the conversation or some complaints and explanation, yes. In the middle, I mean, professionalism, manage the interview correctly, ask it the sufficient number of the open questions, etc. Activity in the identify patient points of view, etc. Summarize the results of patient's admission and check how well the patient understood the doctor's recommendation. For example, first part, anamnesis vita morbi complaints, you have to say, I need some analysis, or I need some analysis, instrumental laboratory analysis, and I need to this. You have to say to actor, okay? You have to say, I need CBC, BBT, or ACG, for example, ultrasound of the thyroid gland or palpation of the thyroid gland, something like this, okay? Did you understand me? This is first part. Okay, second part. This one. Second part, what I said, physical examination, yes?
Yes, doctor.
Demonstration, where is demonstration? Okay. Манзура Сериковна, мой голос садится, можете объяснить?
Что объяснить? Ты все уже объяснила.
Манзура Сериковна.
По-моему, ты все хорошо объяснила.
Да? Манзура Сериковна, physical examination. This is second part. Guys, hand hygiene. You should wash, acting like just washing your hands, okay? Firstly, you will start in second physical examination. You will start like the student washed his hands, and before starting examination, you will acting, just showing, okay? Not real washing. And greeting and the self-presentation. Don't forget, this is 1 point. You will lost. Don't forget about this, like step by step, you should do it, okay? The student greeted the actor and or a teacher after made eye contact. He, what here also, the give his first and last name, specify the name, surname, and age of the patient. All this looks like in the first anamnesis vita morbi, yes? And getting to know a patient, explain the purpose of your study. For example, you want to make like palpation of the thyroid gland or see the foot, diabetic foot, for example, yeah? Or Pasternatsky symptom. What you should say, guys, your purpose, study of obtained the consent of the patient for the examination. Yeah, you will say to actor, yes, my purpose, I want, I need palpation of the, can I, like this, okay? The actor will say, yes, okay. The next step, yeah, position, yeah, next step, purpose of the survey and constant, position, your positions and exposes the patient appropriately, yeah. Physical examination. Now you are starting all this procedure finished, and now you are starting permission. You will take just permission of the actor, okay? Physical examination, inspection of the skin, of the degree of humidity. Okay, for example, patients saying like my complaints, for example, or in presentation will show, yes, the examiners always will show this, yeah. For example, say, I'm sweating a lot or my skin is dry, yes? What you should see? Dry skin, yes? Of course, the actor will not... Who's speaking? Who's speaking?
Brother, please mute your mic.
Mute kar bhai.
It's too hard explaining, guys. So, inspection, after the permission of the patient or actor, teacher, you will start the examination, physical examination. For example, you will see dry skin or wet skin, yes, and thyroid gland diseases or nothing. They will show you the objectives. Okay, so, or like same complaints, okay? After complaints, you will see. After that, examination of the face, eyes, maybe body, skin, folds, reflexes, okay? The next, examination of the subcutaneous fat. This is one disease. This is heals, okay, guys? Understand? In checklist,
Yes,
always giving, Hills. Hints. Okay. For example, I have myxedema. You will see, or like a lot of weight. I take 10 kilograms. Yes, you of course, you will expect your expectation will be subcutaneous fat. Yeah, you will say or calculate the body mass index. Okay, understand? BMI. Did you understand? This is your hints, guys. This is your hints. Look at here. Okay, physical examination. So, examine the oral cavity, mucous membranes, airway, patency. Don't forget about thank you for the patient or actor. Okay, I said thank you to the patient. This is 1 point. After that, you have to wash your hands. This is not real patient. This will be actor or in the of course they are not sick. For example, it's adrenal gland diseases. They will not show the fat, bring fat patient, real patient. It will be actor, but in the laptop they will show you. Examiners will show you the photos, picture of the patient. Okay. You will see. Okay. I mean about exactly endocrine system. Hand again, you will wash after the examination. You will wash your hands, acting, not real washing. Washes hands. After lead syndrome, you have to give description of the, for example, hypoglycemia syndrome or hyperglycemia syndrome or syndrome of metabolic syndrome, maybe yes. And you have to give reasons for this syndrome. What kind of, for example, what did you find here? Fat, yes. BMI is high. In inspection, what do you see? Okay, physical skin, dry skin, maybe. Yeah. Face, body mass index, everything you will collect and say in the endings. Probably this is syndrome, metabolic syndrome or hypoglycemia syndrome. Yes, sweating, something like this. Justification of the preliminary diagnosis based on the symptoms, okay? Only symptoms. So the professionalism, commenting during the examination manipulation, you explained to the patient what, how, and why he would do it, commented, yes, I need for the next step, I need something, for example, instrumental diseases, instrumental examination or some like laboratory instrument examination, etc. It's also giving 1 point. If half, you will give explained 0.5 and nothing. You forget. If this step, it's 0. Did you understand me?
Yes, doctor.
Yes, doctor.
Yes.
Okay. The next step, guys.
Yes, doctor.
Laboratory
Yes,
instrumental examination. 1
Yes,
minute. Last step, guys. In endocrine system will be different diseases, different. For example, first anamnesis vita complaints will be, for example, diabetes mellitus. For example, I'm saying, not exactly. The second physical examination can show you, examiners can show you like for example, thyroid gland diseases, yes? Third step may be hypoglycemia. This, for example, physical examination or laboratory instrumental examination. Okay, this is your hints, guys. Interpretations of glycosylated glycohemoglobin results. Explain the reason change of glycosylated hemoglobin, glycosylated hemoglobin. Interpretation of the glycemic profile. You know, yes, the glycemic profile before, before meal, after meal, how it's changing, etc. Explain the reason of the change in the glycemic profile. You have to explain why it's happened, etc. Okay. because probably maybe it's diabetes mellitus type 1 or 2 because of this. If you are not sure that it's diabetes mellitus, you can say just I'm thinking this is diabetes. Just explain the reason for the change in the glycemic profile. CBC interpretation. They will show you CBC. You have to interpret in use medical terminology. For example, hypohemoglobinemia. Okay, for example, which stage? For example, 109. Which stage? First stage. Yes, first stage. Anemic syndrome, like this. For example, leukocytes is high, hyperleukocytemia. You have to say this is maybe something inflammation or something like this. Okay, urine analysis, ketonuria, for example, glucosuria. Use medical terminology. Okay. So interpretation of biochemical blood test, you know, C-peptide, for example, potassium, sodium electrolytes. How you will say? You will say, for example, potassium is high.
Hyperkalemia.
Sodium is low.
Hypernatremia.
Natriemia.
Hyperkalemia.
ECG results. Yeah. And the endings, you have to summarizing all these analysis, okay, or laboratory instrumental examination. You have to say laboratory instrumental data and identify the characteristic signs of the disease. For example, what is looks like glycated hemoglobin, glycemic profile, C-peptide. What is it, guys? And electrolytes giving. Diabetes, yes.
It is diabetes
Like
mellitus.
diabetes mellitus, yeah. If they
could
will
be
give
diabetes
you
mellitus
age of
or
the patient,
DK.
yeah, if it's young, 16 years old, you have to say probably this is diabetes mellitus type 1. Yes, if
It
it's
could be
fat,
diabetes
yeah,
ketoacidosis.
BMI giving fat, like and old man, woman, you can say it looks like diabetes mellitus type 2, like this. Okay. And the treatment, we need treatment, guys. Treatment plan. Firstly, you have to after summarizing, giving the preliminary diagnosis, you have to say, I'm in this. It's third part. In third part, of course, you will. You have to explain about the principles of the treatment. For example, diet therapy, physical therapy. Yeah. After second, I'm giving, for example, it's diabetes mellitus type 2, metformin first step. If you will say milligram and which the effects of the pharmacodynamics, pharmacokinetics, you will take bonuses. Okay, extra bonus 1 point. Explanation, indication for prescribing symptomatic treatment. Okay. In the laboratory instrumental examination, you should use professional medical language. Okay, guys, I'm finished. I finished. Your questions.
Ma'am, I have 3 questions.
Mhm.
Ma'am, like there would be 15 stations, 3 for each module. Okay, right?
Yeah, 15.
Okay, 3 for each module. So like, can we know like which module would be the first like 3 stations for the endocrine? After endocrine we will get musculoskeletal, after musculoskeletal, like chronology of the modules.
Step by step. Manzura Sirika, do you know? I don't know about it, but it will be mixed. Okay, but they will say to you.
And
Manzura
like
Sirika.
my
Нет, не знаю.
We don't know the step by step which part will be. Yes, for example,
Yes,
first
ma'am.
endocrine system, second like reproductive system, something like this. We don't know, but we will ask about it. Okay, maybe it
Okay,
will
ma'am.
be. They didn't say, our department didn't say the like which how to say. which will be first or second step, I think will be mixed, not like following for one.
Ma'am,
like,
it will be
group.
better if we know about the modules.
What do you mean?
And my ma'am, second question, can I ask?
Yeah.
Ma'am, like now we have checklist. We know about we have to do the physical examination for the complaints. Like we have to do physical examination for the newborn child. So we know from now due to the checklist. But at the stations, like the examiner or the patient would say like we have to do these according to this checklist. Like we do for physical examination for newborn child.
I didn't understand you.
Ma'am,
What
my
the
question is
question?
like now we have checklist.
Say exactly what you want to ask.
Ma'am, I want to ask like how we know at that station what we will have to perform. Like we have many like 60 80 checklist. So how do we know about at that station like what we have to do, like for the examination of a newborn child, for the physical examination of diabetes mellitus?
For example, first station, for example, endocrine system or reproductive system. Yes. You will take the examiners will show, actor will say it, will show now you have to see a physical examination. Yes, checklists will show. You will see and you will see and read the how to say
heading.
what they need. Yes, what they need they will show. Don't worry, they will show you. You mean like which part you should do? Yes.
Yes, ma'am.
For example, anamnesis, morbid,
Yes,
vita,
what we have
maybe
to do
physical
exactly.
examination. Yes, maybe
Okay,
laboratory.
ma'am.
They will show laboratory and physical examination. You will see, but in the anamnesis, morbid, vita, will actor sit and show you. There's some like not show like checklist will show. Okay.
Okay,
Not
ma'am.
checklist. They will say to you.
Ma'am, my
you
last
have to
question.
see.
My last question, please. Like, ma'am, I think 5 minutes is not enough to do all these examination. Like when we start for the examination for a musculoskeletal, there is many steps. Like in a musculoskeletal, there is a checklist for
musculoskeletal. You will ask for
Endocrine है
musculoskeletal
भाई.
teacher. I mean
Oh,
about
okay, sorry.
endocrine
No,
system.
ma'am.
We make
No.
short.
I mean,
We make short, and that's why.
I think
What you
5 minutes is not enough for us, ma'am. Like what we have to
Yes, ma'am,
conclude
5 minutes
everything.
are not enough.
It's too
It's
much less
enough.
time, ma'am.
For example,
That's
5
not
minutes,
enough.
guys. Endocrine system, 3 stations. First, anamnesis, morbid, vita complaints. Yes, asking like interview checklist. For this, 5 minutes to changing from one student, second student will give 2 minutes to read the checklist. Okay, did you understand me? For this 5 minutes, this next station, for example, laboratory instrumental examination, they will give you 5 minutes, 6 minutes. It's enough for you to see explained. For physical examination, also the enough. For example, palpation of the thyroid gland. You will spend 1-2 minutes and explain. It's enough. Did you understand me? To say hello. How many? Like hello. How are you? What's the age?
Ask for name. Ask for his age.
Yes.
Asking for his complaints.
Yeah, 1 minute. You will spend 1 minute. The palpation, I think you will spend 2 minutes. Okay, and it's enough. I think for explanation, 2 minutes. 5 minutes is enough.
Ma'am, but on each station, in order to understand what is the disease about,
you didn't understand. Yes, for every station 5-6 minutes. For changing your students for the next station you will spend 1-2 minutes. It's the examiners will give you these minutes. Okay, don't worry. For example, for interview. Okay, 1 minute. for interview will give 5 minutes, okay, for one station. The next station, it will be physical examination, 5 minutes. So the next station will be, laboratory instrumental examination, 5 minutes. So average for endocrine system, 3 stations, you will spend 15-16 minutes. Did you understand me?
Doctor, while interpreting the CBC and other kind of tests, will we be given the reference values?
Repeat, please.
While interpreting the CBC and other kind of laboratory examinations, will we be given the reference values?
Yes, in endocrine system we put, don't worry. But other systems, I don't know.
Okay,
I think CBC.
Excuse me, ma'am.
Yes, BBC, biochemical test. I think you know about it. It's easy. For example, for hormonal examination, we put the references. Okay, near.
Doctor, hello.
Yeah.
Doctor, can we take a paper and pen with us while the patient is giving the complaints about himself? Can we write these things like the patient's complaints?
Yes,
what the
white.
patient is saying?
Yes, bring with yourself one pen, pencils, or one list. Okay.
Okay, doctor,
One
thank you.
paper. I mean.
Okay,
You can.
this is nice.
Notes ले जाइए साथ.
Guys, 2 minutes.
Excuse me, ma'am. Ma'am, right now you said that after every a practical, they will be given 1 to 2 minutes cap for the for the purpose of studying the checklist. So, ma'am, before the practical, will the examiner or the teacher will provide us the checklist or not?
Before?
तो वो आपके पास ऑलरेडी होगा.
Ma'am, my question is that in endocrine system, we have the 3 checklists, right? One for the anamnesis and complaints, one second for the physical examination, and third for
Yes.
the laboratory interpretation. Okay.
Yeah.
These 3 checklists are very vast, as there are 20 steps algorithms in every checklist. So, ma'am, will the teacher or doctor will provide us the this checklist during the examination or not?
Манзура Серикна, вы поняли? Я не поняла.
Нет, не поняла. Пусть напишет вопрос.
You write.
Я не слышала,
Shut
естественно.
up, Azad, please write. I don't understand you.
Okay.
Yes,
Okay.
references, get reference
Ma'am,
values.
hello, ma'am. The checklist is provided
time will get more
at the time of examination or not? At the time of examination.
Time of examination, we will give you every. You mean the second OSCE part? Yes. Practical
Yeah.
part.
Yes, ma'am. Yes, ma'am.
Now, which group will be they will say to you, which group after one, which group will be come.
Some students get information. They will get checklist at the time of examination, oral examination.
Guys, rejoin, please.
Hello, doctor.
Rejoin.
Hello, doctor.
I have limit Zoom. Rejoin,
तो बस
please.
मैं
Didn't
I'm writing.
or somebody understand? Explain it.
Ma'am,
doctor.
Ma'am, he's asking for will you provide checklists for the oral examination or not? Checklist.
Yes, checklist.
Hello, doctor. Can you hear me?
Yes.
Yeah.
Checklist we sent you.
Hello, doctor. So the
We sent
question is
checklist.
here.
No, doctor.
Excuse me.
Examination.
During
Excuse me.
examination, checklist will not give, just showing, for example, in the complaints, only conversation with interview with actor or teacher. Second part, physical examination will give you some objective or some like hints, okay? Guys, in presentation.
Like we don't have
we'll give
checklist during the examination.
A teacher
Moshna,
will
hello.
give us hint.
We have
Manzura
six.
Serikova.
We have 6 diseases in musculoskeletal. How many cases? If we go to one station, how many cases are we going to get? Are we going to get 6 cases? Are we going to get one station? Like one case for one station. Like suppose we are treating for one anamnesis morbi for one case. Are we going to treat that patient for the same case or are we going to treat 6 diseases?
There is no cases. There is no
ये
cases,
क्या बना
guys.
लो यहाँ पागल गऊ Hello, doctor. Can you hear me?
Yes, ma'am. In the end, we have to say
Hello?
final diagnosis. Yes, you have to say and justify the final diagnosis. Syndrome, at least syndrome, okay? But if you will say the final diagnosis, it will be good.
Hello?
6 different cases. It's not cases, guys. It's not cases, like part of the case, okay?
Hello, doctor.
Okay.
Yes. Who wants to?
Yeah, so my question is here that after doing the first step, after doing the first station, do we get 1-2 minutes so that we can memorize or revise the checklist for the second station or not?
Like this, 5 minutes will give you for your answering, yes, asking or answering to physical examination.
No, after the first step, after the first station,
step,
so
you will
will we
change
get
or changing.
the my
1-2
question is, do we get 1-2 minutes break so
yeah,
that
of
we can
course, of course, not break, not break. Immediately you will change, but the next step will be you can read and before explanation, yes, before explanation you need some minutes, yeah, as I understand.
Okay, so the second question is here, like in the third step, in the third station, for example, we are going to interpret the test results. So should we tell the teacher or examiner that what kind of tests we are going to do, or she or he will show us directly the tests?
Vanya, no, wait. You mean they will show you change. For example, the next step is physical examination or laboratory instrumental, yes? Understand me? You will change, yes, for this 1-2 minutes will give to reading for explanation. You have 6-7 minutes to change the next step, the next station, and read the presentation. In presentation will show you the complaints, not interviews, not including, but laboratory or physical examination, they will show you.
Okay, doctor. Thank you so much. Thank you.
Okay, now we understood.
Don't worry, guys, so much. Everything will be okay. Just read and repeat what we talk about like before on lesson.
Ma'am, we have to say final diagnosis. Of course, in the yes, laboratory instrumental, laboratory instrumental part, you have to say final diagnosis, final syndrome and diagnosis together. Okay.
Hello, ma'am.
Harsh Lalwani, please prepare very hard, work hardly. Your knowledge, you know. Maybe I will take from you. Harsh.
Hello, doctor. Can I ask you a question, please? Hello, doctor.
Yes.
So, yeah. So, for example, there's a final the diagnosis at the end of the checklist. Hello.
एक करके बोलो भाई
Hello.
कोई भी किसी के बीच में बोल रहा है.
Hello. So at the end of the checklist, can you please hello?
Ask one by one.
Wait.
Hello.
Not cases, guys. It's not 6 cases, 6 diseases, but will be one part count. For example, physical
question you
examination.
can write
You have
in
to
chat.
show your
You can write
physical
in chat.
examination. Yes, what you need, for example, palpation of the thyroid gland, something like this. The next step, laboratory interview. Now, what you have to.
Doctor,
Can
I have
you
only
write in
last question. One
chat?
question. Can you please like give me answer?
No,
So at the end of the checklist, there is a like the point that we have to do the final diagnosis. How many points for the final diagnosis? Is there only 1 point for the final diagnosis?
Yes, for each
explanation,
one step, 1 point only.
So if we do the final
Checklist
diagnosis
C,
wrong,
checklist.
if we do the final diagnosis wrong, so we will
You get
they will
0.
cut us 0 for all, or only 1 point will be cut.
No, only for one step.
No, only that step. Only
Okay,
that
thank you
step.
so much. Okay, thank you so much.
Hello, ma'am. May I ask a question? So, ma'am, suppose we started with endocrinology, and our first case, for the first station, we got diabetes mellitus as our case. So, for our second station, will we get the same case?
No, different. For example, diabetes mellitus interview, the physical examination, for example, thyroid gland disease, in laboratory instrumental part, maybe adrenal gland diseases, or again, thyroid gland, maybe something like this. Are we supposed to memorize the treatment plan? Of course, you have to. After your preliminary diagnosis syndrome, you can give the treatment plan. For example, what levothyroxine for hypothyroidism, yes, and syndrome hypothyroidism syndrome. This, and after you have to say, I am giving a levothyroxine firstly because it's and explain. Okay, for explanation of the treatment plan, also giving 1 point, one marks. Do we have, yes, if you can try to say, okay, do we have to read only 3 checklists for endocrinology? Do we have to read only 3 checklists? Yes, only 3 checklists will be from endocrine system. For reproductive system, also 3 checklists. For others, for example, surgery, yes, what did you pass? Pediatric, only 3 checklists.
Also, ma'am, one more
yes,
question.
on every another station has another disease. Yeah.
Okay. Yes, ma'am. So in this criteria, in this checklist, they have written professionalism. So they will will they mark according to how we be how we perform, or do we even have to say will we have to say that we have to act professionally, or we don't have to say that criteria?
Can you write it? Asma or who? Can you write it?
Yes, ma'am.
Write it here, please.
Ma'am, one more question. Ma'am, we will have different diseases for 3 different stations.
Yeah, 3 different stations in endocrine system.
Okay, so ma'am, no ma'am, at 3 different stations, there would be 3 different diseases, or only one disease on all 3 stations?
Guys, for one, I showed you 3 checklists, yeah? Interview, physical examination, and instrumental laboratory.
Labs.
Yes, examination. For every station, this is stations. For every station, we'll give 5 minutes. To changing to others, you will spend the time, yes? For this, we'll give you 2 minutes. So average 7 minutes for one station, the next station, to change to the next station, okay?
Ma'am, can you brief us about ma'am, can you brief us about physical examination?
Case study, yes, in every daily study. Can I explain? It's too difficult to explain, okay? Not for 15 cases. Imagine one case study, for example, diabetes mellitus type 1, yes? In the daily study, you pass. So imagine for one interview, it's in one case you can see 3 parts, yeah, For what is it? Firstly, complaints, anamnesis, morbid vita. This is one station. This next physical examination, one station, and the laboratory instrumental and the explanation of the treatment plan, diagnosis. This is third station, just it, but they will mix the different diseases. Okay, did you understand? Not one diseases, 3 diseases can be. Did you understand me?
Yes, doctor.
This is 3 different diseases, but 3 stations. For every station will give 5 minutes. It's enough time for make a physical examination. You are afraid about it? Yes. Can we? Yes, you have enough time to make it, to pass it.
Ma'am, one more question. Ma'am, like that the first station is about the anamnesis. So ma'am, if we take the anamnesis and there are symptoms of diabetes, so ma'am, without seeing the laboratory results, how can we confirm the diagnosis that it is diabetes only?
According to the symptoms.
Ashruti
Yes, ma'am.
Singh. Ashruti Singh.
Yes, ma'am.
About the treatment plan or what? I showed you what I showed
No,
you.
ma'am. She is asking about the analysis vita and morbid.
I'm explaining the same questions you are asking, the same questions. Look at here. You mean this one? Yes. Question. Interview. Look at the checklists. Professionalism survey plan have collected complaints and anamnesis of the disease. Made an examination plan for this patient. You have to say the patient or actor, what do you need? Okay, you explain the actor to the actor. I need this. I understand your complaints or something like this. Okay, discuss. Use the active listening technique. Manage the interview correctly. Ask the sufficient number of open questions. Okay, summarize the results of the patient admissions. No more. Who asked me? No more. I checked how well the patient understood doctor's recommendations and the plan for action. Okay, not more. After the next steps, you can give the treatment plan, explanation of the treatment plan, and survey plan. Any questions?
I think they will get more information close to date when they will pass. Everything will be clear.
Life hack, yeah, life hack, guys. Who, for example, one group students before the exams, prepare before checklist, print the checklist or see the checklist. Okay, for one day endocrine system and pediatric system come and make acting like you passing the checklists. Okay, it will be automatically during the examination. Automatically, you will ask the questions, etc. Did you understand? Okay.
Ma'am, for all the physical examination, we have to perform for the cardiovascular, respiratory, and abdomen as well for each for the disease. Like we have to do it point to point or detailed.
Manzura Serikina түсінген жоқпын. Жауап беріңізші. Manzura Serikina, help.
Түсінбедім мен оны.
Okay, write it. Right here in chat.
I think we have to do everything according to the checklist. It's written in the checklist.
Just not more things. Just according
according to the checklist. So what's written in the checklist, we have to perform that, nothing else.
Yes,
thank you.
Like robots.
We have to prepare ourselves like robots.
And I really recommending to you. I really recommending to you to come one place or hostel who and come and acting like you are passing the checklist. First checklist this, second checklist like this. Actually, they have hints for you. Okay, and checklists. You will see what they want. What they means. Okay. It's not about difficult diseases. We choose.
Yeah. So, doctor, I have a confusion here. So, if there's like we have to ask according to checklists. If we do like there are 20 steps. If we say the fourth step in place, the third step in place of the fourth step, or like that. If we
like more, yes, you mean more?
No, for example, for example, the third step is the examination of the skin, and we will say we will do the examination of the mouth or eyes. Will there be the problem for us, or
if
it's
you
okay?
will change the places, you mean?
Yeah, places of the questions. Yeah.
The examiners will follow if you say and after that. I think it's not for me. For example, I will sit also. For me, it's not so much important. But if so late, you will ask about complaints before they're summarizing. Of course, it's 0.5
No,
or 0.
not late, but only 1-2 steps. Like if we do the change in the 1-2 steps, like if we forget and then we will ask after 1-2
You
steps.
can change. Yes, you can change. You can. It's impossible to change the steps. For example, in laboratory instrumental and also for physical examination. Okay, but it can be in the interview. I am recommending to write in the paper. Okay, to read and write in the paper what you will ask. Actually, you know what you should ask because it's easy. Yeah. Because we all these 2 semesters we pass case study. It's the same, but this is exams. Okay, exams.
Yes, doctor.
Айтшы шаштарын жинасын деп.
Манзура сенікіне айтқың келмей ма? Аузым шаршады.
Ұмытып кеттім қалай айтылады деп.
White guys, do you know your white coat should be how much? Your what is
long white coat?
Hijab or what?
White coat.
Girls hijab
Yes,
should be. Do you know how you should looks like in the exams? What you should bring from the gloves, white coat? Yes, white coat, not short, guys. Some of you wearing short without the both side is open. It's not the head of department Gauhar Medjubayevna exactly said if any students will come like this look like I don't know from street student, they will not allow. She will not accept you. You lost the exam. Okay.
Ma'am, but we don't have those longer white coats, and we were not informed about this before.
I don't care.
Doctor, about only white coats, or we have to wear the surgical uniform.
Like ma'am, we have to wear also mask and head cover also.
Listen to me. Манзура Сериковна, что там было? Маски, перчатки, белые халаты.
Gloves also.
Колпак?
Все должно быть.
Колпак.
Ногти подстрижены, волосы собраны, шапочки.
Short nails. Girls who's wearing the hijab should be white hijab, white. Okay? Under the halat, under the white coat should be not like long hijab. It's not allowing. Okay,
so about the scrubs,
you can wear under the, but I think it will be very hot, and that's why no jeans, guys. No jeans. Should be black pantalon, black like pantaloons. Yeah, and what else?
So then we have to wear the scrubs if we will not we can't wear jeans.
Normal pantalon, normal.
Брюки.
Yes, ma'am. We don't have scrub pants. We have black
Girls,
pants,
not
but we have don't scrub.
black hijab, no black hijab. Should be white hijab, okay? Under the
And
white
jeans.
coat.
I have black jeans. Can I
Not
wear?
short, long, normal white coat. Should be clean, not like dirty. So the next, no shoes, normal shoes should be, and nails, short nails should be short, not long. One, I know one guy.
Şaşın cinasinde.
Long
Hayır.
nails. And your hair should be like not long, and you have to like under the hijab, or like how to say,
Cover.
yeah, собранный, как? Волосы
Ma'am,
So-
wearing white coat will it count in the professionalism?
Okay.
Hello, ma'am.
Hair should be in a bun, okay, guys? Girls especially.
And what about beard, doctor?
Should be short. Hair must be collected. Back side.
Doctor, what about beards?
Birds? Cut it. I
Beard,
don't care.
yeah.
Cut. Nails, guys. Even not girls, even one. I know one student, long nails should cut, okay? Should be clean, not dirty.
Okay, doctor.
You understand me?
Yes, doctor.
Gloves. Bring with you gloves.
Okay, doctor.
Shoe cover also.
Not sporty trainers. No, it's not alone. She will how to say, leave you in the street, leave you, not even you cannot enter the exams. Did you understand me?
Yes,
Head
doctor.
of department, exactly, she said. Yes, it's happening sometimes. That's why I'm saying to you. Yes, references. You will have values, reference in endocrine system. Exactly, you will have references. Exactly. Maybe not CBC, but electrolyte and hormones. You will have references.
When we know our marks,
I didn't understand. What, doctor? What about hijab? I didn't get it. What does mean? What does mean? She didn't understand. Should be white. Okay, it should be white hijab, but under the leave it in the endings of the hijab. Leave under the white coat. Shouldn't be long outside. Okay, did you understand? I think you don't understand me.
It's only for girls.
Only for girls, yeah.
Can we wear the scrubs?
Yes, you can wear, and white coat also.
Is it mandatory, ma'am?
And 30 minutes ago, you have to come. 30 minutes. And you have to eat or drink something, because not fall down, okay? Be careful.
The location of oral exam will be in Al
Drink
Farabi
or
University.
something like this, okay?
Doctor, location of oral exam will be in Al Farabi University or where?
Not Al Farabi. It will be in Kalkaman or
The oral exam, not MCQ.
Oral exam, yes, in Kalkaman.
Okay, thank you.
And test, MCQ test also in salon in Kalkaman will be conference salon.
Ну, это же будет известно ближе.
Okay, guys, we are finishing. Bye-bye.
До свидания, doctor.
Bye-bye.
And other checklist will send you, okay? 2 or 3 diseases. Others we sent already.
कितने यार?
Already.
Okay, doctor. Goodbye.
Bye-bye.
Good luck.
MCQ, hello.
MCQ.
Yeah, ma'am. What about MCQ?
MCQ,
Hello, ma'am.
you will sit in 2 times you will pass because you are a lot of students, 200 students, and that's why in the morning and after 1 p.m. will be and MCQ exam on mobile will be, yeah. But
On
once
mobile?
no cheat, please, no cheat. Yeah.
Yeah, ma'am. Thank you, ma'am.
Understood. Okay, bye bye.
How can you pass without
About references, I told you about endocrine system. Don't worry, we'll put the references. Okay, bye bye.
Okay, ma'am. That's Vidania. Thank you for information.
Boys, for some of you have long hair. Cut it during the examination, okay? Go
Ma'am,
to
we
barber
already
shop,
cut it down.
cut your beards or everything. What you have hairs, okay? No rings, guys. No rings. Something.
Okay, ma'am.
Everything. Leave everything. I don't know other systems, guys. I don't know.
Ma'am, glasses.
They will say to you. I think it's first time in the
At least we can wear glasses.
Yes, glasses. Bring glasses. Gloves. Bye bye.
Bye, ma'am.
Paka.